what is the blood-brain barrier and what is it normally doing in our bodies? And then what do we know about some of the effects of cannabinoids on this barrier?
Yeah. So the blood-brain barrier is basically the defense between your blood and your brain. And the reason you need a defense system there is that there's stuff in your blood that your brain doesn't necessarily want to be exposed to. So you don't want your brain seeing everything that's in your blood because it would be damaging to the brain, basically. So it's a way of keeping out anything that shouldn't get past. So normally at a capillary level, where you have that kind of greatest transference of gases and substances between your blood and your tissue, the adjacent tissue, normally that's quite porous to allow for a lot of exchange. We want glucose and, everything to be passing very easily between a tissue and the blood. But in the brain, we don't want that. So we have adapted that barrier. Instead of being quite porous, we've adapted it to being a much tighter barrier. So the cells are all really tight together. And there's actually a number of cell layers at the blood-brain barrier to make that even tighter. So it's like having triple glazing as opposed to single glazing. And you've got endothelial cells from the vascular side of things. And then you've got a couple of layers of different types of brain cells as well that make this really tight barrier. And it's very much in control of making sure that all of the bad stuff that's circulating in your blood doesn't get into your brain. And when things go wrong, that can become leaky. So that barrier can begin to break down and you can start seeing holes either between cells or actually through a cell. And things like, there'll be a couple of things that will happen. You can have too much fluid leaking into the brain. So you can have edema that can cause swelling of the brain, or you can have things like cytokines or too many immune cells getting in, or, being exposed to lactate, or lots of different things that are in your blood that you don't really want in your brain. So if they get leaky, that really can damage the brain. And the blood-brain barrier does get leaky in a lot of neurological conditions. And our research looked at how cannabinoids affect the blood-brain barrier, and whether or not any of the positive effects of cannabinoids, which had been seen in some neurological conditions like stroke, could be because they were having a direct effect on this blood-brain barrier function. So we set up we set up experiments where we mimic the blood-brain barrier. In cell culture conditions, we grow all of the different layers of cells that are appropriate for a blood-brain barrier. We grow them together and we make this basically like in vitro version of a blood-brain barrier. And we make it leaky by causing a stroke within the cells. So we deprive the barrier of oxygen and glucose to mimic what would happen in a stroke. And the barrier gets leaky. And what we found is that we looked at different cannabinoids, but primarily most of our work was focused on cannabidiol at that time, because there is quite a lot of data showing in an animal model that if you give cannabidiol, that it prevents it doesn't completely prevent the stroke, but it reduces the size of the damage caused by a stroke. So that area of the brain, which would normally have necrosis, so tissue cell death, is a lot smaller if you give cannabidiol in advance. Now that's not very translationally relevant because we don't always know when people are going to have a stroke, so it's very hard to pre-medicate them with things. But anyway, so we were looking at whether or not cannabidiol would work in the blood-brain barrier. And basically what we found in a nutshell was that it was very beneficial. So cannabidiol helps to make the blood-brain barrier tighter. So it can, if we induce that leaky barrier by inducing a stroke-like environment, then it makes cannabidiol makes the cells tighter much faster, and it reduces the inflammatory response and the cell damage caused by that stroke. And that persisted even when it worked when we gave CBD before the stroke, at the same time as the stroke, or even up to, I think it was 6 hours after the stroke was induced. So And we looked at the mechanisms by which that happened. And one of the major receptors that was involved was the serotonin receptor. And the serotonin receptor is known to be involved in a lot of the the brain responses to CBD. It's like the major brain target for CBD. So it was primarily by the serotonin receptor and this other nuclear receptor I mentioned before called PPAR. So we did a lot of work on that. We also looked at some of the endocannabinoids, and we found that there were two in particular that also had this kind of protective function on the blood-brain barrier, and they were OEA and PEA, so the endocannabinoid-like molecules that I mentioned before. And then we also looked at some of the more novel minor cannabinoids. So we looked at CBDA, which is the acidic version of CBD, which is what the plant actually makes. And we looked at CBG, and we looked at CBDV, cannabidivarin, because that is a compound that people are interested in, maybe in epilepsy or other neurological conditions. And they all had a good response. I'd say the best probably came from CBDA. CBG and CBDV were also anti-inflammatory, but I don't think they were as good as CBD. I mean, the responses weren't as overwhelming as the CBD was, to be honest.
I see.
But yeah, that was quite a lot of work that we did, showing that cannabinoids in general are protective at the blood-brain barrier, which probably underpins quite a few of the neuroprotective effects of cannabinoids, if you can really maintain that barrier integrity and keep the brain from being exposed to things that it shouldn't be.
Mm-hmm. So based on what you said, is it fair to say that for CBD and some of these other cannabinoids, the neuroprotective effects are often what you might call preventative, meaning that the molecule needs to sort of be there when the insult happens to the brain, and it doesn't, does it do anything afterwards?
So it does, both cannabinoids do, but the problem is experimental studies tend to either pre-administer the cannabinoid or give it at the same time as the insult.
I see.
There's not enough researchers actually looking at what happens when you give these compounds after the problem has already been established. And I'm probably talking more about the historical literature. I think people now are doing more translationally relevant research, and they are including, doing that post-insult treatment. But it is true to say that their best effects are seen when you give them in advance. But yeah. So I think, and there are situations where a problem is coming. So there are
sports.
Yeah, exactly. So there are conditions where that's relevant, but there were, for something like stroke, that was never relevant because you never know when something is going to hit you like that. Yeah.
I see. So I think, there is, I don't remember the specifics, but, in mixed martial arts and I think American football, they're looking into different CBD based products or sponsoring research, but that's an area where you think it's plausible where, if you know that there's going to be physical, damage to the brain that's likely to be happening, that having something like CBD in your system could actually help mitigate some of the damage and some of the risk there.
Yeah, I'd really welcome seeing that kind of research being done, because the hypothesis is very plausible, and there is animal data to show that CBD is protective in models of traumatic brain injury. Endocannabinoids have also been shown to be very protective in traumatic brain injury, and there's good evidence to show that CB2 agonists are. So we've got a lot of animal data to support that kind of research. And so I think it's really important that those studies are being done. I hope they're using effective doses of CBD. I think that's sometimes where some clinical studies fall down in this area is that the doses of CBD used are quite small. So yeah, I really welcome seeing that kind of research, because the theory is really strong, and the science that supports that clinical research is very strong.
Mm-hmm. Ballpark, when you say relevant doses of CBD, what are you talking about, and how does that compare to what's in a CBD product that you're likely to buy in a store?
So it's quite different. And so this is where this kind of, for me, there's a big difficulty in people using the evidence that we know about the clinical use of CBD into and translating that into over-the-counter use of CBD, because you're not talking about the same kind of doses. Most clinical trials that use CBD use hundreds of milligrams per day. So anywhere between 1 and 800 milligrams per day. If you are somebody who's epileptic, the average kind of dose is something like 12.5 milligrams per kilogram per day. And that is very different to over-the-counter products where you're probably, some of the tablets I've seen of CBD are maybe only 10 milligrams per capsule.
Mm-hmm.
And if you remember, I said that that's only 10% orally bioavailable, then only 1 milligram of that 10 milligrams is probably going to get into your 5 liters of blood.
Mm-hmm.
So if you do the maths on that, what is the circulating level of CBD, knowing that the potency of CBD at any of its molecular targets is quite low, you need micromolar concentrations of CBD to have most of its biological effects, just doesn't marry from a pharmacological point of view.
Mm-hmm. So in theory, if you were to consume CBD orally, you would get more of it into your bloodstream if you ate it with a fatty meal or if you inhaled it, say.
Yes, but with a different profile when you inhale it. Yeah.
So,
and there's other things to take into account, like the fact that there will be accumulation with time, and so, and what I would like to see is more research being done on this kind of chronic low dose CBD and what biological effects it's having. Because the problem is none of the science that's out there really supports low dose CBD. Everything that's been ever done in animal models or in clinical trials is with much higher doses. So what we need to start seeing is there a really an effect that we just don't know about that happens with low. I mean, I don't want to use the word microdosing, but using maybe up to 50 milligrams a day. Because there will be accumulation with time, and there will be changes that will happen over time. And there's definitely people for whom they're seeing drastic effects. So we just need to see some more science behind that, and it's not being done at the moment because this over-the-counter use of CBD is quite novel. Whereas the scientific research into CBD is older. That's been going on for, well, maybe only about 10 years, actually. I started doing research on CBD in 2005, and hardly anybody was doing research back then. Everybody was still looking at THC. There was hardly anything being done on CBD. So there's still a lot to be done. But coming back to the effective dose of CBD, I did analysis on this where I looked at all of the clinical trials that have been conducted with CBD and analyzed whether they were effective. So did they meet their primary endpoint? Did they have a significant change in their primary endpoint? And the one differentiating factor between the trials that were successful and the trials that were not successful was the dose used. So if you were a successful trial, you tended to use over, I can't remember the exact cutoff, but it was over, I think, maybe 300 milligrams per day. And anything less than that on the trials were not successful at meeting their primary endpoint. Yeah,
that's what I've heard. Around about 300 is where you tend to see some effect, and we really don't have much evidence for things below that. Out of curiosity, when they do these clinical trials, do the patients tend to have an empty stomach and take just the medicine, or how does that play?
No, they will be advised to take with food.
I see. Okay.
Yeah. But there's so many things that I think what we need to do is make CBD more druggable. So it's really not very effective giving somebody oral CBD knowing that only 10% of that gets into them. So we need to find better ways of giving CBD, and then we don't need to give such high doses. Because if you could give, 300 milligrams of something that was 40% bioavailable, then you'd be getting, you'd be able to reduce your dosage. You'd probably see less side effects. So I think making better versions of CBD, ones that get into your system better, using pharmaceutical strategies to make better formulations of CBD, are all things that can be done to mean that the doses that we need can start coming down. But mostly at the moment, we're excreting most of it.
I see.